Hey, it's Lisa DeBoer from Pedi-Ed-Trics, and I'm here with your best practices for Peds Prep in Seconds. We have this gorgeous lab room that we have set up, Peds Prep in Seconds. We have 3 stations already done, and now we're going to do the very last one so you know how quickly you should be able to do this. Open up your Mani-Kid, take out of your folio the card, and you're going to see that the child, this Mani-Kid, matches the one that I have here. It's that simple. This is going to go down. You're going to want to throw down your Brazos tape, PD wheel. If they're going to be using apps on their phone, that's totally fine because the system works with all of them. So that is absolutely fine. Whatever they're going to use in real life, let them use it in this class. That's super important and it's absolutely allowed. The folios, all the colors and everything match. If you're going to want your student to do credit hours, you have to do the same colors throughout the whole thing. So module C, it's going to say scenario C4, all of those match the colors all the way through. So if they're going to want to do credit hours, make sure you use all of the same ones from that module to do that. So what we have the students do, so we've got our, this is all set up, and then we also have the meds that come with it because you have 4 in there. So we've got meds, you've got epi. Go ahead and set up that stopcock so that way they can draw up the epi, especially those little tiny doses. We want them doing that. And then just set up a station like this all the way through. It sets up literally in seconds. We've had this took us about 60 seconds to set this up. We made it so easy so that you can do the training with your students instead of having to do all the work to get this ready. The other part of it is if you want to check the answers. So on the answer sheets, you're going to get these and we allow you to photocopy them. So if you notice, it says this is scenario C4. So up here, scenario, you would write C4, and you're going to have your student actually answer them all the way from basic to expert level. That's how these answer sheets work. When they first start, what we recommend for best practice, have them read the scenario all the way through every single time. Read the scenario when you first go up to your station. This is a 6-month-old with a history of congenital heart disease and supraventricular tachycardia. She is lethargic with poor peripheral perfusion. That's the very first thing we want them to do. Then, second thing, have them scan the QR code because this takes them to an instructor that will pop up and tell them specifically about this kid and what's going on and what they really need to know. So that is super important. Have them read it, have them scan this, and then if they want to take notes, we actually did a cheat sheet note over here. We call it a little Peds Pearl. This tells them what they just watched in that video so they can take a picture of that. Have them go from basic, advanced, all the way to expert. And then on that answer sheet, the very last question is going to ask them, I watched the quick tip video, and it's either yes or no, and what was the topic? In this case, they should write SVT. It's that simple, and then when you go to answer the inside of the module, you have the answers for you as the educator to check them for your students. They can also, this is a neat little tip about this system, if you want them to get credit hours after and you don't want them to use class time to get their credits online, take a picture of everything and we tell you exactly how to do that. Go on the back of the card. This is whether you're doing it live right now or you want them to be able to do it after the class. They're going to need a copy of their answer sheet, and they're going to need to take a picture of the front and the back of any one of the cards, and it will walk them through exactly how to do it, because what we did is we put step by step 1, 2, 3, 4, 5, 6 exactly how it's going to work. They're going to scan that little QR code in the front, and then they're going to be able to just go through, boom, 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 enter that access code that's on the Mani-Kid. That is your personal access code. If you use all of those up for all of your students, you can always order more. Contact us at info@pedi-ed.com. We can get you more should you need those at a nominal cost. And then it just, when you get to the end, they're going to get a certificate mailed directly to them. So they will put in their credentialing information, including if it's for medics, Cap C, we have those too. So if they put on all of their national registry and everything, we have that set up so that they can actually get their credit hours that way. Nursing, respiratory, paramedics, and EMTs, you have credit hours for both of those. Now let's say you want to keep going with the class. You're like, oh, this was great. We just did an hour of training. This is wonderful. Let me go ahead and do another module. It changes out this fast. Let's say I go and I grab module D. This one is the trauma module. This was a bonus one that we put in. This one, what's interesting is you're going to find something called removable moulage in here that you're going to be able to put on the patients throughout the scenario. So now I'm going to change out that scenario card. Now this is scenario D4, that same little baby right here. This time they're gonna read, this is a 6-month-old in respiratory arrest, was unresponsive, a front seat passenger in a motor vehicle crash with airbag deployment. Intubation attempts by medics were unsuccessful due to anatomy, quote unquote, that didn't look right. So now they're gonna run this scenario, again, basic all the way down to expert. Make sure that they do that quick tip video so that they have that great information that they're gonna need. But the other part of it is that the moulage pieces, you're actually gonna be able to find those and then put them specifically on to the patient. So here's just one of them really quick. These are little sticky dots on the back, and it tells you exactly where to place them on the card. And then when you're done, this just comes right off and back onto your moulage backing sheet. And that's as simple as it is. Here's the answer sheets, same thing. Colors match the colors. And the kid is that way for grading, you're able to see, here she is. And these are all of the answers that went along with that scenario that we just showed. And that is your best practices for Peds Prep in seconds. So whether you are working in the emergency department, whether you're a PEC and you're doing outreach education, or you're in an ambulance bay and you just want to do some training with your students or in any classroom, this is a perfect, super simple way to get some pediatric training. So hopefully that has helped. Best practices, this is Lisa DeBoer signing out, and check out our In Seconds University for more ideas and quick tip ideas for things you can use with all of our systems, the In Seconds brand. Thanks and God bless.